got the recording. Okay. All right. So our email addresses are here. And I believe you're going to be getting the PDF of this presentation at some point. So you'll have access to that. So this is our CEU process. You are going to be getting a CEU for this presentation. The key is you have to stay till the very end of the talk in order to get access to the evaluation link. And you have to fill that evaluation out within 48 hours of the talk. So the best thing to do is to just do that right away after we're done with the talk. And then you'll get your certificate. You can get a screenshot, and we'll go over this again at the end. So hopefully if you have questions, we can talk about that at the end. We don't have any financial arrangement related to the content of this activity. And the views expressed in this presentation are not necessarily those views or policies of the University of New Mexico. So just to get those disclaimers out of there. Okay. So what are we going to talk about today? We are going to spend the hour talking about models of supervision. This is very much an overview presentation. It's kind of a dip your toe in the water type of presentation. And the hope is that you'll take the information from this hour and use it to if you haven't already, figure out what your style of supervision is and match it to some of these models. So for each model, we're going to talk about an overview of clusters of models, and then we're going to see some examples. Then we're going to go on to next steps. We're going to have a little discussion and some Q&A at the end. So why do we even have supervision models? One of the main reasons is to help structure supervision. Models are good for growth and the health of supervisees to help them grow along their path. There's a lot of different styles and models that you can use. The great thing about using a model and adhering to it is that you can make sure that your supervision time with your supervisee doesn't turn into an admin meeting, and it can just help structure the time. This is a really great resource, Fundamentals of Clinical Supervision by Bernard and Goodyear, a really great resource of all the different models that are out there. And it's been really helpful in terms of helping me find my own style of supervision and understanding what models are out there should I decide to change anything. So I recommend it, especially for those of you who are newer to the field. Usually what supervisors do is they will choose a style or model based on their supervisee, the populations that are actually served at the agency, and the culture of the agency itself. There is also a clinical supervision implementation guide. And if you're not familiar with this has been around since 2018. Jen was one of the team members who created this, and well, it's been around, I guess it's 2019 technically. So, this is the link. However, we're actually currently working on an update to this. Hopefully, I don't want to even say when it's going to be out at this point, but it's coming, coming soon. But it's a really, even this version is really a great summary of the models. I found it really helpful for that. Okay, so now we're going to get into some of the specific models. The ones we're going to talk about today, the groups, we're going to go over some psychotherapy-based models, some developmental models, some process models, and target issue. We're going to try to go over the basic concepts of each model and then talk about examples under this category. Now, just as a caveat, it's important to realize that we've covered several models in here, but it's not everything. And so just encouraging you to do your own work and your own research. So we're going to start with psychotherapy-based models. So the key about psychotherapy-based models is they're usually based on the model that you're treating clients with within your agency. So if you're treating clients with like a solution-focused model, then using a solution-focused model of supervision can be very helpful. It can be very relevant, and it can help especially new supervisees really understand terminology based on that specific model. And so that's basically what you're going to see here in the next couple of slides, is the model is going to correspond to the way you supervise someone. So some strengths is what I talked about, is that, you know, when you have a particular model that you're using with clients, switching over to a supervisee and using the similar model, except in terms of supervision, can be helpful, and it can clarify things for the supervisee. The problem is that sometimes it can turn into therapy if we're not careful. And we're always towing the line in clinical supervision of not jumping over into therapy. And, it's not always easy. At least in my practice, there are times when I feel like I'm jumping over into therapy, and we just want to make sure that we're guarding against that as much as possible. And it's also difficult to use psychotherapy-based models with certified and credentialed professionals. So certified and credentialed professionals are peers, CSWs, CPSWs, all of the certifications that you can get in behavioral health. And more in New Mexico, we're seeing more and more certified and credentialed professionals in our agencies, which is a wonderful thing. It's great to have certified and credentialed professionals. However, in terms of supervision, it's hard to do psychotherapy-based models with certified and credentialed professionals, because they usually would need more training in the specific model in order for it to land well. So a good example of a psychotherapy-based model is a CBT model, right? So everybody knows that CBT in therapy, it's about managing thoughts and feelings, and in so doing, you're changing your behavior, right? And we're focusing on the present. It's short term, it's goal oriented. Everybody knows pretty much what CBT is. It's a very common therapy. For supervision, what you're doing is you are focusing on the thoughts and feelings of the supervisee in terms of their professional life, and how they're interacting with clients as a professional, and really trying not to, again, cross over into those personal issues and doing therapy. But what you're doing, so some of the activities you might be doing is setting an agenda for supervision, which is very common in CBT. You're bringing material in from previous supervision sessions and addressing it, and really having it continue from one session to the other so that it's seamless. And you're also might be assigning homework and assigning assignments to the supervisee that are related to their growth and learning. Some more examples of psychotherapy-based models are these listed here. We're not going to go over them specifically, but they are all very, I think it's important to just check in with them and find a blurb somewhere, especially if you can get your hands on that book. You'll get a sense of different models of psychotherapy based. The main thing to remember is that the psychotherapy models are based in the therapy that you're doing in the agency. It's just using it for supervision. So in terms of psychotherapy-based models, you can use 2 or more. You can use more than one. However, you have to be kind of savvy with this and not do it too, without thinking hard about it, and I think it's easier to do this if you have more experience as a supervisor, because it really, in order to practice with fidelity, it requires adherence to the individual theory. Now, we're all human, so we're gonna, go back and forth at times regardless, and it may not, be exactly what it may not match the theory specifically, but it's just important to be aware of why you're crossing over from one psychotherapy-based model to another. It's just about self-awareness and understanding. And, if you're a less experienced supervisee, additional training is always great. We always want additional training. So, so let's move on to, oh my goodness, I went through that really fast. Jen is gonna talk about one of my favorite models, which is the developmental model, and we're gonna go from there. So I'll stop my share.
Thanks, Lisa. And I'll just say, regarding integration, I think and having a rationale, it's not unlike therapy where, sometimes people want to say like, well, I'm eclectic. I draw from, multiple things, but then if you can't actually, which it's fine to be eclectic, although sometimes there's been pushback against the idea of even saying the word eclectic, because sometimes people say eclectic and they mean that they don't want to have to tell you about the rhyme or reason behind anything they're doing. And so, when we're thinking about integrating more than one thing, we just want to make sure that, there's a rhyme and reason behind it. So let's talk about the developmental models. So, this is progressive stages of supervisee development. And so there's basically like different skills, different tasks that people are trying to accomplish at different levels. And this should give an idea of, the supervisor should do an assessment, informally, of where a supervisee is at, so that they can help them identify what are some of those things that are going to help them progress professionally. A lot of the models in this area, in this category, refer to it as scaffolding. This is why we've got a picture here of said scaffolding. You're going progressively further up. That said, even with that image in mind, we're not talking about a process that's necessarily linear. We have so many skills as clinicians that we can be at different stages with different skills. So it's not like all of them are going to be at the same experience level at all times. And especially even somebody who is more experienced may have a lot of anxiety or difficulty with a brand new scenario. And so they might, you might be considered at an earlier developmental stage professionally with addressing these kinds of situations. So some strengths of developmental models is, I think it helps create a lot of structure for supervision, because there's kind of some clear tasks that you're always working on, and like goals that you're aiming towards. The developmental models can also be really easily applied to all types of supervisees at, all different points in their career. And so this can work a lot more easily with, say, folks who are certified and credentialed, all the way up to somebody who is, a postdoctorate level. Challenges is that, the developmental models really don't give a lot of guidance about what therapy should look like for the supervisee, in terms of structure or interventions. So you might want to pair a developmental model with a psychotherapy model, for example. It also, some of these don't really clearly locate the supervisor. The developmental stages are really talking about the supervisee quite a bit, but don't necessarily place where is the supervisor in all of this, other than the idea of maybe like the supervisor as an authority figure. So probably the most familiar developmental model is reflective supervision. And this is, also one of the oldest models of supervision, at this point, over 90 years old. And it's, a lot of you have probably heard of reflective supervision before. It's used pretty widely in a lot of professions. And to a certain degree, we use reflective supervision, whether that is an explicit centerpiece of our model or not. But, because a major task of supervision is looking at, trigger events, which could be anything where, the supervisee is having a hard time as a clinician, or something went out of the ordinary with their client, anything like that, we've got to reflect on those. Now, sometimes people struggle with the idea of reflective supervision as a developmental model. A lot of stuff that you see out there about reflective supervision don't even reference the idea of it being a developmental model. But, something that Bernard and Goodyear talk about in that textbook is that basically, because reflective supervision is trying to not just look at the situation itself, that trigger event, whatever that might look like, we're trying to envision what could be, how do we grow from this? How do we move forward? That is an inherently developmental activity. So that's why Bernard and Goodyear place reflective supervision in developmental models. So a couple of developmental models that are relatively common in healthcare fields, one is Driscoll's What model. So this was originally developed for nurses, but can be used in behavioral health. So, and it's very, very simple. It's just, the what, the details of whatever occurred. So what, in terms of thinking about feelings and actions, and then now what? How do we, what are the next steps? Very simple, very easy to implement. And then another one is Look, Listen, Learn. So this is came out of child welfare and like doing other kinds of youth and family work. So basically ensuring that there's time to reflect, and that there's a good collaborative relationship between the supervisor and the supervisee. So this is one where we actually at least have like identified where the supervisor is and they're working together with the supervisee. And then also looking at the regularity of supervision and reflecting on why that's not happening regularly, if that's the case. You know, certainly in a lot of places that have like really busy workflows, like child welfare, but certainly other settings, maybe supervision's not happening that often. And so, you know, which it really should be if it's going to be effective. That's certainly what the research tells us. And so looking at like, you know, what are the barriers or reasons that this is not happening? So some examples of some other developmental models, the integrative developmental model or IDM, you know, this is probably one of the best known that's out there, and it's got 3 different levels. Ronstadt and Scoville-Holt's lifespan model, I probably mispronounced that. But those, so they take the 3 from IDM and then built 3 more on top of that to kind of reflect later career development. And then there's also systemic cognitive developmental supervision or SCDS. So, you know, and this is one that does actually incorporate a little bit from psychotherapy, since a lot of it's influenced by Piaget. And this is a particularly popular one in marriage and family therapy. And, you know, this is the only one that really doesn't have, you know, that we're covering today that doesn't have like scaffolding. Instead, there's like 4 orientations and they're all considered like equally important tasks to complete professionally. So now let's talk a little bit about process models. So process models are focused on the experience of supervision itself. So this is getting even further back from, you know, what's happening in the therapeutic relationship specifically. Not that you don't cover that, but it's also trying to look at, you know, kind of the bigger picture, including how the individual, how both individuals are experiencing supervision. So, you know, and that alliance that they're having. And not just that, but you know, the really big picture of like systemic issues, societal issues, things that are happening outside of the therapy office or the supervisory, you know, time that are impacting what's going on with supervision, what's going on with therapy practice. So, you know, in process models, the supervisor's role can vary, but you know, and sometimes even within a single model, the supervisor has more than one role they can take. But usually it's like relatively clear, like what the supervisor is specifically supposed to be doing. The process models are also, I think, very appealing for professions like social work, where macro considerations are very important. Not that other professions don't care about that, but you know, social work puts a particular emphasis on that. Some challenges is that, you know, unlike some of what I was just talking about, like with the reflective supervision models, where, you know, these are relatively simple models, the process models tend to have quite a bit of components to them. And so that could make it a little more difficult to implement or to kind of like remember or have on the front of your mind. Also, you know, even though there are all these pieces, they don't necessarily include psychotherapeutic or developmental considerations. Some of them have some of that in there, but that's not necessarily a guarantee. So a process model we're going to highlight here as an example is the Hawkins and Shohat model. And they refer to their model as the 7-eyed model of supervision, which is, you know, this image that we see here on the right-hand side. So, and I'm sure even just the visual helps you kind of get the idea of how this is a little more complicated than just going through like, you know, the what model. So you've got the client, the supervisee's interventions, the supervisee-client relationship, the supervision relationship, the supervisor, and then like the wider context, that's that dotted line. And then in addition to those 7, there's 5 factors that can impact any of those 7. So that's supervisory style, supervisee developmental stage. So there's developmental stage, referenced in there. Supervisor and supervisee theoretical orientation. So it doesn't prescribe a theoretical orientation, but it's asking us to keep that in mind when we're thinking about this whole process. The supervision contract, and then also the type of supervision, because how you're approaching things or how people are responding to things is going to vary if you're doing individual versus group. And so the supervisor here is a very active role. Like I said, with the developmental models, a lot of times the supervisor is just kind of this like authority figure. With the psychotherapy models that Lisa covered, it can vary quite a bit. Sometimes the supervisor is this very kind of like distant, neutral person who's just like listening. In this case, the supervisor is really like getting in there. They have to acknowledge like what they're bringing to the supervisory relationship. They have to acknowledge they're responsible for that contract, what kind of orientation they're bringing, etc. And then here's some examples of some other process models. So the critical events and supervision model, this does borrow from psychotherapy because they're using like task or chain analysis to analyze situations that the supervisee brings to supervision. And so, this is a little more narrow in that it's really trying to focus on these kinds of events and like how to resolve them and build skills so that the supervisee knows what to do in the future. There's also Bernard's discrimination model. This one has actually been researched quite a bit and is pretty popular as a process model. So there's 3 foci for the supervision, and then 3 roles for the supervisor. And so these can change every supervision or even during a single encounter of supervision, depending on what the supervisee needs. Sometimes they may need an educator on interventions, and other times they need a consultant around conceptualization, et cetera, et cetera. And then there's the systems approach to supervision, and that has 6 dimensions. And that, I would say that one gets the most explicit in terms of like kind of big picture, looking at like what's going on in this agency and the policies that are affecting supervision and therapy here, and just looking at those, again, those macro concerns. And in this model, it's very collaborative, and the supervisor and supervisee are really working together and sharing power in that dynamic. All right, and now we'll cover target issue models. So these are, I would say, the most narrow and specific, kind of like the name is implying, because it's looking at addressing very specific issues or populations. A lot of these are newer models, but they tend to build on past ones that exist, including ones that are outside of target population models, but cobbling it together to make these work for the specific issue or population that they're attempting to address. So, these can be really helpful if, you are in an organization where you are working with very specific communities, or you're commonly encountering like challenges around providing services, in the particular space that you're in. You know, these can help answer some of those questions or give guidance. A lot of these address culture better than the other categories. You know, you haven't really heard us mention that before now. And it's because a lot of the more established models really don't talk about culture of the clients, the supervisees, the supervisors at all. Challenges to these models is that, um, you know, finding the one that's going to fit those like target areas that you're looking for, those target issues, can take some research. Because, you know, this is, as you might imagine, even though we're talking about things that are fairly narrow, in these target issues, this is an incredibly broad category. And so, you know, there's not really, unlike the other ones that we talked about, there's not like unifying concepts amongst the different models. And so it can take a little extra digging to find one that is going to suit your needs. Um, you know, and a lot of times they do have to be paired with something else to kind of meet all the needs of the team that you're supervising. And, you know, the last thing is that a lot of these models, because they're newer, there's less writing about them, there's less testing on them. You know, that doesn't mean that they can't be useful. I mean, frankly, in terms of, you know, there's some models that have a lot more research behind them than others. In some ways, these are more similar to theories in a lot of ways. I mean, supervision models in a broad sense. But I would say the target issue models in particular haven't had as much kind of like testing about how like supervisees respond to them. So an example target issue model is the synergistic model for multicultural supervision, or SMMS. So they actually took 3 different components of other models to make a model that more comprehensively addresses multicultural practice. So they took Bloom's taxonomy, which that's what the image is over here in terms of, you know, different levels of knowledge. And then they took the heuristic model of non-oppressive interpersonal development, you know, looking at you know, developmental stages in terms of somebody's cultural competence or cultural humility. And then they also took the multicultural counseling competencies. Some of you may be familiar with these, you know, attitudes and beliefs, knowledge and skills. You know, basically, these are all 3 areas that are important to develop in terms of having at least some kind of baseline cultural competence. I'm more of a fan of talking about cultural humility myself, because sometimes competence is used as this idea of like a finish line. You get there and like, you know what you need to know, which is clearly not how this works. But I think in terms of, I think competence as more of like a starting point, that it's like, here's the like the bare minimum that you need to know, is probably a more useful concept. So some other target issue models, there's the queer people of color resilience-based model, which is really trying to address racism and heterosexism simultaneously. A lot of the target issue models only address race or, you know, homophobia or heterosexism, and not both. It also recognizes that supervisors can be a part of one or more marginalized groups. I would say that's a real weakness of a lot of multicultural models for both therapy and supervision, is not recognizing that the provider or the supervisor can also be part of one of these groups, and sometimes multiple groups. So, you know, the themes and competencies in this model are focused on supervisee and supervisor development. And then like the center of the model, because there's some nice imagery that goes with this one, is resilience. And then I'm also a big fan of the components of enhancing clinician experience and reducing trauma model. You know, it's very specifically trying to target compassion fatigue and burnout, which we know is a huge problem in our field. And so this is really giving the supervisor 5 components to address with supervisees around building self-care skills. And there's also a component in there for the supervisor in terms of addressing organizational issues that, you know, could be barriers to self-care on the job, and trying to make sure that there's kind of an eye on the organizational culture, rather than expecting supervisees to only have recovery from their job on their personal time. So I know that that was quite a crash course in terms of covering, you know, quite a bit of material, you know, like Lisa said, this is an introduction. And so, but we did want to, you know, encourage everybody, and we are going to have a little discussion here too. But we did want to encourage everybody to do more research and reading to help yourself find the models that would be right for you. You know, I think it's very important to think about what aligns with your, just kind of what comes natural to you in terms of your supervisory style. Like, you know, if you're a naturally collaborative person, then picking a model that, you know, that would be the role for the supervisor. You know, your supervisees needs, you know, areas of growth. Obviously, you know, you don't want to put yourself in a situation where you're having to implement wildly different models for each supervisee that you work with. That could get really unwieldy. But what are the types of things that are common for your supervisees, you know, in your setting to be working on as tasks in their professional development? And then obviously we have to consider organizational needs. You know, like Lisa said, with the psychotherapy based models, it does make a lot, it can be very sensible to have, you know, the components of the common modalities in your organization baked into the supervisory model, because it's another way to kind of like reinforce these concepts. And then, of course, the systemic challenges, you know, things that could be, you know, maybe you want to look for a model that's very specific about addressing group supervision, because the way that things are structured at your organization, there's no time for individual supervision. You know, all you do is group. And so, you know, how do you make sure that you're picking one that's actually going to work for that kind of setting? So we wanted to have a little discussion in Q&A. You know, certainly if any of you are using specific models, we would really like to hear from you and have you share with the group, and also any resources around specific models or anything that you think would be helpful for supervisors to clarify their own style of supervision. And then, of course, any other questions you might have. So I'm going to stop my share so we can easily see each other. So yeah, I'd love to hear from anyone in the group about models they're using, suggestions on kind of figuring out your own model, or questions that have come up for you in seeing this presentation.
And you can just feel free to just raise your hand and unmute yourself. That way we can see you, and or you can write in the chat. Either way.
Go ahead, Eli.
Hey, yeah, I use a CBT based model. And yeah, one thing I thought I'd share with the group is I keep notes on my supervision sessions with like the follow-up or homework assignments. And one thing that I find useful is like in preparation for the next session, I'll copy the old note, write in any agenda items that I have, and then I have that old follow-up. So it's a great place to start and strings together that continuity with my supervisees and shows them that I'm also like paying attention and following up on their requests for me. Like I have a homework section for myself as well in my notes.
I love that, Eli. And that's a great example of that kind of bridging or like connecting the different supervisory, um, sessions like Lisa was talking about, just so there is that continuity. That's great. Also, I will just say, as somebody who I had a supervisor for a while who was very CBT oriented and had previous supervisors who were not. And it was a little bit of an adjustment for me, like to have homework. I was like, what is this? So like, am I in school again? Why do I have to do this reading? But I actually came to so appreciate it because I think it's, in terms of our professional development, it's not enough to just say, oh, I'm going to go get some CEUs in 6 months or something like that. If we've got a pressing issue with a client or an area we know we need to grow in now, why wouldn't we do some reading between supervisions, for example?
And
Yeah.
some people wrote some stuff in the chat too. Eli, I'm sorry. Were you done? Did you
I just
want
figured I'd keep talking since yeah, I also one thing I'll add, and you were talking about this like the eclectic approach, but I do also really enjoy DBT models, and since they are so connected with CBT, one other thing I make sure to do is start my supervision sessions with a little bit of grounding or mindfulness. And I find that my supervisees like really, really, really appreciate that, because we're all super busy and our brains are very full. And even just like the 3 to 5 minutes of whatever it is. And sometimes all we do is go sit outside in silence for like a full 2 minutes, which feels really long, even though it sounds really short. Yeah, I found that to be like incredibly beneficial. And I do that for both individual and group supervision sessions. That's all I was going to add.
That's great. Thank you so much for sharing. Lisa, you were reading the comments in the chat.
Yeah, so there's some really good comments in the chat about integrating the CSERT more, the trauma-based model of supervision from Laura Baker. She's been using IDM and integrating self-care, but thinks that the CSERT might help her do this in a more structured way. And Hoyt uses developmental supervision with a target model to address challenges. And we have Rodney, who uses MST model for supervision, multi-systemic therapy model, because the focus is on developing goals and objectives towards clinician development. It also has good techniques for case conceptualization, which is excellent. I think Rodney and others, if you can incorporate case conceptualization into your supervision, I'm sure that is obvious to most people, but I'm just seeing more and more students and more new supervisees coming out of school really not really knowing how to conceptualize a case. So thanks for all your comments. These are great. And if you want to pipe up and say more, please do.
Yeah, Boyd, I don't know if you want to say more, but I am curious what target model you use. If you have, if you're able to share more on that.
So what I meant by target model was if there is something that first, I'm primarily concerned about the development of the supervisee and client care. But sometimes on the administrative side of the house, there are things that need to be addressed and fixed, like completing your note, like billing on time, those sorts of things. And so when there is something specific that has to be addressed, I shift over to addressing that topic specifically rather than the development generally of the supervisee. That's what I was trying to get across with that.
Okay, yes, I see what you're saying. And yeah, I mean, that is, I think, a whole other kind of like balancing acts that a lot of supervisors have to do. You know, I think for Lisa and I, it's been a real luxury. The supervision program that we run together, we're only doing clinical supervision.
Yeah,
And it's really nice to only have to focus on that. Most supervisors are, having to do a mix of clinical and administrative, and some of the feedback we've gotten is that it's not always easy to draw that line between, when you're doing clinical and when you're doing administrative, especially if it's something like, not just the quality of how their notes are written and not just how, it could be like, well, there's a billing issue here, but also it could be like reflecting difficulty with formulation or something like that. And so, administrative supervision definitely has its role in all the other tasks that we're doing too.
Yeah, sure does.
Thank you. Elizabeth?
Hi, Jen. Sorry, my camera, I can't get it to work at all. I was trying. But yeah, just to kind of go off of that, that's kind of my thing. So I offer clinical supervision, but I'm also the administrator. And so kind of going back and forth, I learned, I have a supervision course that I took a long time ago, and we really talked about focusing on your roles and your functions in supervision. And so I kind of have this little, like with clinical supervision, I know what my purpose is. I know my outcome for that day, my time frame. I have an agenda, right? So just my basic process of what that's going to look like. But I also do that again when I have my administrative supervision, right? So keeping those roles, like making sure, and then my function that goes along with it is really important too. So I really like hearing all these different ones that people are using for models. So I've been taking notes on them. But I know for me, what works is when I know each time I'm going to have supervision, having my purpose written out, having my outcome, my time frame, making sure I have an agenda. It doesn't have to be super long, a couple items. And then what is my basic process for that day? So like in clinical, I know that I'm teaching, I'm learning specific skills along with them, guiding, evaluating their job performance, different things. So I'm learning objectives. For administrative, I'm really looking at like clarifying agency expectations, right? Going through those policies, those procedures, ensuring compliance. But I always want to make sure that I keep that process for myself so that I don't, like he was just saying, sometimes you go back and forth. And that's hard for the supervisee, right? So just wanted to say that because he brought it up. And I think that's really important because more and more we do blend our roles sometimes. It's just the agency that we're at the time or where we are and what we have to do to continue each day.
One of the things that I do is in my agenda for that session, I will separate the agenda between clinical work and administrative work. So there is I try to make sure that I'm not confusing the two for the supervisee. There are tasks that we have to get done, but then there's also their development, and I don't want those to be confused. So I will often, when I write my agenda for this particular supervisee, put the administrative stuff at the bottom of the list, and we'll do clinical supervision most of the time.
I appreciate both of you sharing that, because I think, you know, the other thing is when you are trying to balance those two, sometimes you can run the risk of one just really dominating the other. And I think there's a lot of supervisors out there where, because of the pressures that you have going on above you, that it can be very easy for it to just turn into administrative supervision all the time. And, you know,
Yeah.
I think both of you are talking about how important it is to guard against that. You know, we need to, of course, administrative supervision has its role. If there's some important pieces to it, you know, that we have to bring up. And, you know, if we want this person to actually grow professionally, we need to make sure that clinical supervision is happening.
Mhm.
We've only got a couple of minutes left, and so I'm just going to go ahead and share a couple of things with you all, so that you can get your CEUs and also get, you know, the information about the rest of this series if you don't already have that. So the next presentation is going to be next week with Lisa, talking about trauma-informed supervision. I'm really excited about this one. I think it's going to be really interesting. And so it'll be same time, you know, 12 to 1 next Thursday. And, you know, Lisa or Alex, if you don't mind sharing the link to this one in the chat. And we'll also put the flyer for the rest of the series in the chat as well, just in case you don't have that already. Because we've got presentations that are all the way through May, and on a wide variety of topics related to supervision. So, like Lisa was saying earlier, and like Alex put into the chat, you know, you need to complete your the evaluation that is on this next page. We're going to have a link and a QR code. The completing the evaluation in the next 48 hours is how you get your CEU certificate. So you complete the evaluation, the certificate pops up. You either take a screenshot or you can tell it to like email it to you. Do not close it out until you've either gotten the email or taken the screenshot. And you can reach out to Alex and the rest of the CE team if you need to, if you're having trouble with that, at this email address that's down here at the bottom. But yeah, like Lisa was saying, I just encourage doing it right away. You know, it doesn't take that long, and then that way you don't forget about it. So here's that link and the QR code. And I think, oh, and Alex just put the flyer in the chat. Great. And Alex already put the link to the eval in the chat. I'm just going to put it down there one more time. Or you can take that screenshot real quick, or not screenshot, the QR code real quick. Take a screenshot of the CE certificate. So we'll be here for, we can hang out for another couple minutes, but since I know a lot of us are doing appointment-based work, you know, if you need to get going, you're free to go. We thank you so much for joining us here today.
Somebody in the chat said that they didn't sign in, but you signed in just by registering. And
well, and by attending.
And so, by attending, right.
Yeah. Yeah. Nobody needed to put their name in the chat to get credit. We've got the attendance report of who is here. So